there's a certain level of human adaptation that needs to happen with something positive and fantastic that happens in your life to regain the stability that you had before. Think about your own life. There are probably so many examples. I recently moved into a new home. Everyone was like, congratulations, this is amazing, a new home. And it was wonderful for a few months, and then also incredibly stressful. And then, of course, I had the delayed stress reaction 3 months later, right? Like where you're running on adrenaline initially and everything is great. And then that stops, and then you're, having sleepless nights about all the various stressors. So the rule of two is based on this idea that positive life events, things that you think might be really helpful to you to manage your stress, if you do them all at once, chances are it's not going to stick. So instead, aim to do 2 new things at a time, build them into your life over time. In the 5 resets, I offer 5 mindset shifts, 15 science-backed strategies, and every step of the way, it's about 2 small changes at a time. You work with your biology of stress rather than against it and competing against it. That is how you make change possible. In clinical practice, when I was a medical resident learning how to take care of patients, my mentors would do the same thing. So this is 50 years later after that study. They taught me that when I'm seeing a patient, a patient will come in with a laundry list of symptoms, or they will have 6, 7, 8 medical conditions. You always focus on 2 things. Because if you say to the patient, I really think you should stop smoking. Here's some suggestions. Let's work on your weight and get your weight better. Let's work on your cholesterol. How about your blood pressure? How about minimizing chances of cancer? Too overwhelming for the brain to sustain. Instead, let's focus on getting you to stop smoking, and let's focus on lowering your cholesterol. These are 2 tangible things that you can work on. It takes about 8 weeks to build a habit. Once you are engaged and that has become a habit for you, then you add 2 new things. Let 8 weeks go by, then 2 new things. So over time, you do address that laundry list of symptoms, or in this patient's case, all 8 medical diagnoses. In the other patient's case who came in with everything but the kitchen sink approach to managing his stress, we eventually did get all the way to the finish line of fixing his stress and addressing all of the issues, but it only happens 2 small incremental steps at a time.
The 5 resets,